I'm Dr. Sanjay Panicker. I founded Amrita Homeopathy 21 years back in a small town in Kerala. Today we are placed in two locations at Korumangala and Marathalli with 5 doctors working under the clinic, including 2 MD doctors and a few staff. We specialize in hair and skin problems, respiratory problems, allergies, pediatrics and infertility. Spondylitis is an inflammation of the vertebral column, and ankylosing spondylitis is where there is ankyloses. Ankyloses means fusion of the vertebrae. Vertebrae are small bones which are placed one upon the other along the spinal backside, the vertebral column which is there on the back, the backbone. So if it gets fused, you do not have the flexible movements which would otherwise be there for a person. So what will happen? He automatically cannot bend like how the other person is able to bend. So usually this problem starts in young age and not seen in elderly people. It's seen symptoms start off in a very young age, like 20-25 years or sometimes even 15-16 years. They usually present with severe back pain, lower back pain, and when you examine the patient, you find that he cannot bend and touch his toes. He has difficulty, he has severe pain when he bends. Another thing, he cannot touch the chest with his chin. Usually like how we can touch, he may not be able to do it so easily. When he leans against the wall with the heel and the entire back touching the wall, and then you ask him to touch his chin on the chest, he will not be able to do it. So if we go for the blood test, Hla-b 27 comes out as positive and various other factors are there. So once it is diagnosed as ankylosing spondylitis, then the treatment for that is important. Otherwise it keeps fusing. The bones keep undergoing fusion and becomes like a rigid structure which cannot bend and cannot be flexible. The arch which is there in the lower back, which is naturally there for everybody, a slight bend in the lower backbone, that particular bend becomes more or less straight, and so the patient loses that arch over a period of time and develops severe backache. So there are so many wonderful remedies. My first remedy of choice in most of the cases would be based on the symptoms and not exactly always the same remedy, but very often we come across remedies like Rustox and Fost as primarily indicated in many cases. Excellus and vomica also has helped a lot of cases. Lycopodium and Natrum are other remedies which have helped me based on the presentation. Usually Rustox, the patients are better when they have pain, better by continuous movement and worse in the initial movement. As soon as they start moving, they feel severe pain, but as they move, they become more and more free over the rest of the day. When the pain is better by heat, Fost helps in a lot of cases. Lachesis also helps in many patients with this kind of pain.